Good morning. My name is Michelle Owenby, and I'm the president of the Enos Park Neighborhood Improvement Association, which is where you happen to be, in case you didn't know that. Thank you very much for coming out and celebrating with us on this beautiful morning. We are so excited about this Access to Care Collaborative, and particularly pleased that it's being recognized nationwide now. I still remember a few years ago when I got the original phone call from Mitch Johnson with Memorial asking if our neighborhood would be interested in partnering on this venture, and he told me a little bit about what the Access to Care program was going to look like, and I said yes, we would definitely want to come alongside SIU and both of the hospitals in that venture. But at the time, I don't think either Mitch or I had any idea what the reality would turn out to be and how much of a profound impact it would end up having on our neighborhood, because it has indeed been a game changer for us. We did a master plan for our neighborhood back in 2010, so we already were in the process of implementing that and had a lot of good things underway, including our land bank to acquire distressed properties and pass them on to be renovated and turned into single-family owner-occupied homes. So there were already a lot of good things in the works, but having the Access to Care program has proven to be a huge piece of that puzzle. It's really changed our neighborhood in a variety of ways, from drastically reducing the number of police calls to service, to stabilizing the housing, giving us a tool to work with landlords and encourage them to move in a more positive direction, and really providing very holistic services for the individuals who are already living in our neighborhood and helping to stabilize them as well. So we're just so pleased to be a part of this. We look forward to the next few years. And at this time, I'd like to invite Doug Shaw from the American Hospital Association to come up and say a few words about the award that we're receiving today.
So each year, the American Hospital Association honors with NOVA awards no more than about 5 collaborative programs that are the bright stars of the healthcare field. And we honor them for addressing not just the physical needs of those in their communities, but also the economic and social needs as well. And also for working with other stakeholders in that community to see the health in that community improve. So today it's my pleasure to recognize one of these bright stars, the Enos Park Access to Care Collaborative, and 2 of the organizations that sustain it, HSHS St. John's Hospital and Memorial Medical Center. Give them a hand. The awards community, the awards committee was really impressed by how the collaborative improves access to care in the Enos Park neighborhood. We see a number of awards every year, or a number of award nominations every year, but what really blew us away was how it was such an integrated approach to not just providing care, but by helping people to really take some, to understand better how to get that care, to create more self-sufficiency in taking care of themselves and in working with their neighbors. And it certainly had great benefits in terms of reducing emergency department use for non-emergent care and things like that. Across the nation, we have learned to count on our local hospitals for being there for us, to care for us when we're sick. But what this collaborative reminds us of is that our hospitals are also there for us to help keep us healthy, to help us keep us well, to develop and build a society of communities where all of us can reach our highest potential for health. At the American Hospital Association, we are just so pleased to honor the Enos Collaborative for the breadth and tenacity, the teamwork that has gone into the work thus far. And as a Chicago native, I'm kind of reminded of what architect Daniel Burnham once said. Make little plans, they have no magic to stir men's blood. Well, you've realized an audacious plan with maybe a magical touch to stir this community and really improve the lives of those in it. So thank you to all the partners, providers, participants in the Enos Collaborative. Together, you did earn this recognition. And on behalf of the American Hospital Association and the AHA NOVA Award Committee, I present 2018 AHA NOVA Awards to Dr. Charles Lucor and Ed Curtis. Come on up, please.
Good morning, everyone. What a beautiful day it is out here today, and I want to thank everyone for being here today. I want to thank the American Hospital Association for recognizing our community. And while Dr. LaCour and I will accept the awards from the AHA, we both want to acknowledge that we're receiving this award because of all of you and everybody in the community that have worked so closely to achieve the outcomes we have here today. I want to personally thank Dr. Tracy Smith from SIU School of Medicine and her tireless efforts to really reach out with the community workers and touch people's lives. I want to thank Dr. Janet Albers, who is here today. Janet is chair of the Department of Family and Community Medicine, SIU School of Medicine, and leads many efforts in our community, one of which is our federally qualified health center right here between our two hospitals on 4th and 5th Street on Carpenter Street. And what they do in family and community medicine and allowing Tracy and everybody that works in that department to touch this community is amazing. When you think how they've integrated behavioral health into the neighborhoods, that too has made a profound impact on this partnership and what we're doing. Michelle Ownby, we want to thank your neighborhood association. Michelle's been tireless in her leadership, and she won't take the credit. It's a lot of people in this neighborhood that are working together, but wow, some of the outcomes we're seeing here in the community. Employment is up. Time spent in jails is down. People have more access to employment. And more importantly, we're seeing those healthcare outcomes improve in our community right here in Enos Park. And that's what this is all about. It's not so much about recognition of all of us here today. It's about the lives that we're touching here in the community. Lynn Scott's here as chairman of the board of HSHS St. John's Hospital. Lynn, thanks for the leadership of your organization and what you're doing in the community, working with Memorial, working with our medical school partners. And I want to thank our mayor, Mayor Langfelder. The community and the city has been behind us. And today I see Chris Jones here as one of the Springfield Police Department members that's responsible for this actual neighborhood. Chris, thank you, but I know you're not willing to take, I can't quite see him because of the sun in my eyes. I know Chris is here. We've talked this morning. He would share this with all of his other colleagues that are here today. But wow, it's everybody working together that's made this so successful in the community. So on behalf of the AHA, Dr. Lynn Bias is here also from AHA. Lynn, would you raise your hand? Thank you for your leadership. And of course, I want to thank all my colleagues at Memorial that have been so instrumental in this as well. So with that, I will turn it over to Dr. LaCour, and he'll make some comments on the project as well. Chuck?
Thank you, Ed. Well, good morning, everybody. It truly is an honor on behalf of the Board of Directors of HSHS St. John's Hospital and our 3,000 colleagues to be recognized by the American Hospital Association for the Enos Park Initiative. I want to thank our partners, the Enos Park Community Improvement Association, Memorial Medical Center, SIU Family Practice, for your work with us to really help us bring our mission of supplying Christ healing love for all people to the community to improve access of care for the residents of this neighborhood. I too want to recognize our city and our mayor for your support. You know, 38% of individuals in this neighborhood had more access to care. They were getting health care in the right place at the right time by the right personnel. What was so amazing about this initiative is that it wasn't only about access to health care. That access to health care improved overall well-being of the community and also improve the economic activity within the community. This is a model that we hope other communities can replicate, and it is an example of how collaboration can really help community partners work together to improve the well-being of those residents in our community. I do think it's a model that we would hope to see taken to other areas of Springfield to improve the overall access to health care and also well-being of other neighborhoods that need help. Thank you. And then next I'll invite Tracy up.
Thank you for coming out today. I'm Tracy Smith, and I want to thank the American Hospital Association for this recognition. Basically, we all know that the places we live, learn, work, and play are just as vital to our health and well-being as the health care we receive and the choices we make. But for years, these components have been largely overlooked by the healthcare system. When communities and healthcare do not work together, we see the results. Those results include poverty, crime, homelessness, hospitalizations, illnesses, and hopelessness. So none of the outcomes of this program surprise me, because this program is where the community and healthcare systems came together. And I was fortunate enough 3 years ago to be asked to be part of this program. And for someone whose career has focused on community health, there's no bigger reward. It was the ability of the healthcare leaders in Springfield to move outside their comfort box, to see that they must step back and take a holistic approach to health. And that required them to look at the social determinants of health, and not just health care or hospital care. That was only the first step, though. It took the community and the wonderful community health workers to take all the next steps to community health improvement. First of all, the residents and the social service agencies serving Enos are the individuals who have and are doing the hard work. They received some assistance from our community health workers. We had Shelley and Shirley, who started out with us, and now we have Bridget, who's here in the audience, and Jim, who are continuing to make sure that trust and relationships are the foundation of this work. Because we know without trust and relationships, these 3 years would not have resulted in the community improvements being celebrated here today. And SIU was lucky enough to come along as the catalyst for their hard work. Thanks to all the work by the residents and agencies serving Enos Park, we're seeing a ripple effect to other neighborhoods and organizations, not only in Springfield, but in our neighboring communities in Illinois. I look forward to the next 3, 5, 10, 15 years. I'm not going to go 20 because that's a long ways out for me. Because working with healthcare organizations such as HSHS St. John's and Memorial Medical Center, the strong and caring residents and dedicated service agencies and police in Springfield, our growing support from our local government, I can only imagine what can grow and blossom in Springfield. And I believe that the residents who have been touched can summarize the work better than anyone standing up here today, so I wanted to share 3 quotes from some residents that have been involved with our program. One woman that worked with us said, "I'm missing a mom, and having someone to call and double check on me kind of helps me, you know." It's very simple, but that's the focus of our program. One of the workers that works at a service agency here in Springfield said, "I work at a homeless shelter at Inner City Mission." And one of the community health workers, Shelley, came in and was offering services to our residents that had never been offered before. One of the things she did was to help our residents find a family doctor, and that made all the difference in the world. And then finally, one young family, and the mom of that family said it best, "Getting off the medical card is stressful, and it's overwhelming. Not that you want to be dependent on the government for your lifespan, but the transition. Without that kind of help, I think it's very difficult, and I could never have done it." So I want to thank everyone who has believed in this program, and I want everyone to, just be proud of what you've done. Thank you very much.
Good morning. What an exciting time to celebrate the nationally recognized Enos Park Access to Care Collaborative. Congratulations to HSHS St. John's Hospital Memorial Medical Center and SIU Center for Family Medicine for your innovative, collaborative effort to improve health and quality of life in the Enos Park neighborhood. Thank you to the American Hospital Association for recognizing their efforts and awarding this prestigious 2018 NOVA Award for their worthy efforts that is the model for others to follow. And Doug Shaw said it best. This is an award, it's a Bright Star initiative recognizing the efforts of everybody. And this is truly Springfield, and that's what it's all about. Springfield's all about family. And as we know, when one family suffers, we all suffer. And thanks to our medical community, we really can't thank them enough to where they led us to today. But to fully appreciate today's celebratory award, we should think back to 3 years ago when this collaborative initiative started. HSHS St. John's Hospital, Memorial Medical Center, and SIU Center for Family Medicine made the partnership with the Enos Park Neighborhood Association for an announcement of a holistic approach to family health care by taking on the daunting task of going door to door and assessing the entire family's health care needs, including their living environment. Little did they know, we were leading into times of uncertainty. Federal health care unknowns, struggling state budgets, and economic challenges. However, the three champions of healthcare did not get deterred. They stayed focused on their goal and truly understand that in our community, as in with any community, it's all about the people. If one suffers, we all suffer. Our medical community has led the way for Springfield to become the model city, and we cannot thank them enough. Words cannot express the eternal joy, gratitude, and pride I feel as mayor, as most importantly as a Springfieldian, with the tremendous accomplishment of HSHS St. John's Hospital, Memorial Medical Center, and SIU Center for Family Medicine on their achievement of receiving the American Hospital's 2018 award. Springfield's greatest resident, Abraham Lincoln, said, "The best way to predict the future is to create it." On behalf of the citizens of Springfield, Alderman Proctor, who takes great pride in this neighborhood, and really all of our citizens, we can't thank you enough. Our deepest heartfelt congratulations and thank you for your leadership, because this is not the end, this is just the beginning. We continue to build on. I encourage everybody to drive through the medical area. It's just not about buildings, it's about our people. And they understand it. They've helped lead the way for our brighter future of tomorrow. So thank you for all your endeavors. Thank you, Michelle, for all your good works. Marilyn Pyland, it started way back when, and you can see how great strides Enos Park has gone through the years, or through the decades actually, and great years, and our better days are ahead. So we cannot thank you enough for this prestigious award. All you do to help each and every one in our communities to not only make us healthier, but make us more prosperous in the process. So thank you all for your leadership. Ed Curtis, Dr. LaCour, Dr. Jerry Cruz, Tracy Smith, Dr. Tracy Smith, and really making this award and achievement possible for Springfield. This is truly Springfield, as you can tell with everybody that's participated in this endeavor and those present. It's not about one individual, one person, one entity. It's about all of us working together to make Springfield the model city it can be for others to follow. So thank you very much.
Well, as you've heard from so many different people so eloquently this morning, it took a lot of different partners to make this project such a success over the last few years. Certainly the medical institutions were instrumental in their leadership, but the city of Springfield, the neighborhood, and the many different community partners all came together to make sure that this was a success. Enos Park is actually my volunteer role. In real life, I'm the publisher for Springfield Business Journal and Illinois Times, and I just want to point out we have some copies of the Business Journal that just came out yesterday on the table. There's a familiar face you may recognize on the cover. She might be signing autographs later. but no, it's a very it's actually our annual healthcare issue, appropriately enough. And so, knowing that this ceremony was coming up today, we chose to feature the Access to Care program, and so it's a good overview, and it interviews a lot of the different partners that were involved in this project. So I do encourage you to take a look at that.